Hello, I'm Victoria Voysey and I'm the Managing Director for InMode UK and Ireland, and I'm here to have an amazing chat about women's wellness today with the lovely Dr. Shirin Lakhani and Claire Pecoraro, our clinical trainer for InMode UK and Ireland. Good morning.
Good morning.
How are you both today?
Very well, thank you.
Good, good. So I'm really excited about the conversation we're going to have today. We're going to be talking all about vaginas and vulvas. I'll get told off by saying if I only say vagina, but it's vulvas as well. There's a lot of nicknames for this kind of women's intimate area. What's your favourite nickname?
I hate all the nicknames for it. I'm a big advocate of calling a vulva a vulva. Okay. I think the nicknames add a silliness to it. They add the taboos. I mean, I've had some amazing nicknames. I mean, anything from fairy, foof, mini, flower, lady garden, everything's out there, but I'm sitting there trying to educate women and encourage them to use the proper terminology so that we can remove some of the stigma around it.
I think that's good. I think, you know, my daughter's quite young and at school they're already kind of talking about these things and they are saying the word vagina and they are saying the word vulva. What do you use in your house, Claire?
So we use the word farfalla, which means butterfly, or fiorellino, which means little flower.
Okay, so this is the Italian version.
Yeah, absolutely.
You're adding a little bit of glamour today with the Italian version.
We love it in Italian though, doesn't it?
It does. You do make it sound better. You do make it sound better. You know, I'm trying to use this as a platform really so that we're talking more about women's wellness. And I know you're a bit of a women's warrior, I like to call you, Shirin, which is what we need more of in the society at the moment. So tell me a little bit about you know, the concerns that you're seeing, your clients, your patients that come in. What are you generally seeing when they come into clinic?
All sorts of things, Victoria. So I see a lot of women who've got problems related to childbirth, so stress incontinence, vaginal laxity. I see women with menopausal symptoms, so we're looking at the dryness, the irritation, frequent UTIs as well. And then I see a lot of genital skin conditions, in particular Lichen sclerosis, which is very much not talked about. It's a condition that most doctors don't even know how to diagnose.
Yeah.
So
tell us what it is. Tell us a little bit more about it.
So it's a genital skin condition. It mainly affects women. It can affect men as well, but predominantly it's the vulva that's affected, and it can extend around to the perianal area as well. I see so many women who are told they've got recurrent thrush, or they've got eczema, or just some sort of irritation. And it's a really debilitating condition because it's remitting and relapsing. So these women get flare-ups where they're very symptomatic. They get itching, burning, tearing with intercourse. They can't wear the clothes they want to wear, and they're just in discomfort all the time. Yeah. And then it goes away and then it comes back. And the problem with it is if you don't treat the inflammation, you get structural changes to the genitals as well. So you can get fusion of the labia, you can get complete coverage of the clitoris by the hood. You can get midline fusion. So some of these women have really small vaginal openings to the point where they can't have penetrative intercourse anymore. And then they get cuts and bleeding and things like that. And in rare cases, it can progress to vulval cancer. So it's really important that it's recognised by us as medical practitioners so that we can get the women on the correct treatment and not just send them away with Canesten.
Yeah, which I think is probably happening a lot, isn't it? I think, you know, we talked about the NHS a lot before, but, you know, our first line is to go to our GP about anything to do with women's intimate issues. And even that is quite a big step because a lot of women will just suffer in silence. And we hear that a lot, especially with things like incontinence. So I've got 33% of women actually suffer with incontinence at some point in their life.
I think that's an underestimate, actually, because as you get older, you're looking at the majority of women. Yeah. And the problem with incontinence is it's normalised. Yeah. You're told it's part of getting older, it's part of having children. Oh, I just leaked on the trampoline, giggle, giggle, giggle. Yeah. But what I like to tell people is it might be common, but it's not normal and you don't have to put up with it.
Yeah, absolutely. So 1 in 3 women are having these incontinence issues. You think that's vastly underestimated?
Absolutely. I get it a lot in clinic where I say to someone, do you suffer with incontinence? And they say no. So then I rephrase it and I say, have you ever leaked urine when you didn't mean to? Yeah. For example, when you cough, sneeze, laugh, jump, run. And they all say, oh yeah, I do that. Yeah. That's not incontinence, is it? Yes, it is.
Yeah.
It's because it's so trivialised and normalised in our society, and women's health problems just don't take priority.
Yeah, you're absolutely right. I think we're used to just suffering in silence. Women, you know, we don't talk about these things. Even with our girlfriends, it still feels really taboo. And I think InMode and us as a company this year are really on a mission to remove that taboo and really champion women's wellness, which is why we're doing these kind of platforms and having these kind of conversations, because we want people to be having more conversations about it, for sure. We've got a big demand for these women's wellness therapies that we're doing with our Empower RF system. It's growing. It's not growing as fast as I want it to be. We're not talking about it enough. In other countries, particularly the Middle East, I always kind of compare us to, they're so far ahead of us with this. Why do you think that is?
Go on, you go.
I mean, I look at the concept of going over to Italy. So, I mean, they're very much more, they go to gynecologists on a more regular basis. It's brought up with them. So once they hit 18, you go and visit your doctor on a regular basis. Whereas we don't get that opening or that opportunity to go to the doctors to see them. So we're encouraged to have a better consistency healthcare program ahead of us from a young age when we're in Italy. And for me, it was one of those things also at a young age where I had my 3 children and I had all prolapses, so at a very young age, and it was straight on to sort of looking into, let's repair this, you're too young, you can't go on with this, where they don't have the opportunities over here because they're not approached about it or they're not given direction. But that's just from the European side of it, I would say. So.
Yeah, I would definitely say a lot of the European countries are ahead of us as well. I want to change that. We've got to change it together by having these conversations. It's so important. So we've talked about incontinence. Shirin, tell us, what are the different types of incontinence that you see?
Okay, so the one that happens when you cough or sneeze is called stress incontinence.
Okay.
And that's when the abdominal pressure is higher than the pelvic floor pressure, so you leak urine.
Okay.
Okay, and that's the one you need to do your Kegel exercises for. Okay, and that's something, again, in the UK, we're told to do them, we're not shown how to do them. The majority of women I examine don't activate their pelvic floor effectively. So even though they think they're doing the right thing, they're not. So that's stress incontinence. The other type is urge incontinence, and that's more when you have an overactive bladder. So you feel the urge to go and you can't hold it, you have to go there and then. And an example of that is when you get the key in the door and you're just busting for the loo and have to go. You can also have mixed incontinence, so you have symptoms of both.
Okay.
And then there's neurological diseases that cause incontinence as well, but that's a bit more complex.
So we talk about incontinence. There's these different types of incontinence. A lot of people are suffering with them, suffering in silence. Some people come and seek treatment, which is great, and that's what we want to encourage a lot more of. You mentioned Kegels. They are really hard to do.
Yes, they are.
How do you teach somebody to do it?
One of the ways is when you're examining them, you ask them to squeeze around your finger. So it's an internal examination. So I actually assess how effectively they're contracting their pelvic floor. And also the strength of the contraction as well. And it's incredible how few women actually can do it properly. We do have physiotherapists that can teach them, but they're not widely available on the NHS. And even if you are lucky enough to be referred, you only get maybe 1 session. Whereas in France, every woman has physiotherapy after childbirth.
That's amazing, isn't it?
We need it here.
We do. So a much easier way for me is to have an Empower treatment and come in for a VTone. So your VTone is how many Kegels, Claire, you can tell us?
Oh, I mean, it's like, I don't know the extent.
Oh, okay. So one VTone treatment is the equivalent of 30,000 Kegels in 20 minutes. And it's a lot nicer to just come in, lay there. Tell us a little bit about the treatment, the VTone treatment, when you actually have it done. It's not that scary, is it?
No, it's not scary. Initially, women find the sensation odd, but they get used to it very quickly. It's really simple. It's slightly invasive that you have something inserted in your vagina, but it's not uncomfortable at all. And a lot of women who I treat with VTone actually then can engage their pelvic floors more actively when they're doing their Kegels at home. And I do encourage all women to continue with Kegels because having these treatments is great, but you want to maintain it as well.
Yeah, absolutely. I mean, for me, it was much easier to just come in. I was quite scared when I went for my first VTone. I expected it to be like a smear test, or, you know, you don't really know what to expect. And I think that's something that we need to talk about a lot more as a company. You know, I actually did the insertion myself. I was talked through it. I had control of the machine. And I think that's really key, having control of it and giving your patients that control.
Giving them the option. Yeah, giving them the option. A lot of my patients just want me to do the machine for them.
Do they?
Yeah. But it's nice because I stay with the patient until they're up to their power level that we want to get them to.
Yeah.
We sit, we chat, catch up on things. And then if they want to have a little snooze while they are having the treatment, they can do that as well. So a lot of them say it's a nice break from their life. Yeah. And they're coming in and doing something active to look after themselves as well.
Absolutely, absolutely.
I found a big difference with doing just the one treatment when I tried it.
A lot of my patients say that as well.
And I was really quite surprised. I mean, I felt it actually really, really comfortable, but it made quite a significant difference to the sensation and a little bit more control after one. Yeah. So, you know, after having a proper course of treatment, I think that's going to make a huge difference.
I've not had one person yet who's not had some degree of improvement. Yeah. So you might not be able to take away all the symptoms. It depends on how bad they are to start with, whether or not they've got a prolapse going on, etc. But every single patient I've treated with VTone has had some degree of improvement.
Definitely. I noticed a difference after the first treatment. I normally have to get up to go to the loo about 3 or 4 times in the night. I only have to get up once now, if that, and sometimes I don't need to get up at all now, which is great. And, you know, for me, that improves my quality of sleep. And I think that's something that we don't talk about either. Women's sleep is really disturbed by this kind of thing, and that affects your whole quality of life, doesn't it? Claire, tell us a little bit more about the other treatments that you can have with Empower.
So with Empower, you can have the Forma as well. It's an internal probe that goes inside the vagina, and what that will do is heat up all the internal parts, and we're working on the collagen elastin. So you're building up a nice healthy thicker texture of the wall, so you're strengthening it and you're getting a nice healthy collagen barrier as you're doing that, and that's extremely comfortable, and that's just heat. One of the other treatments you can have as well is the Morpheus internally.
Sounds scary, Claire, is it?
It sounds scary, but it's not really scary. You can have like a numbing cream that will obviously numb the area for you. The majority of women feel absolutely nothing on that skin, so that's really, really a good bonus to it. And that really works on really creating a sort of like a micro wound and a trauma to the skin, so it activates the strengthening up of renewing the cells, and then again injecting it almost with that radio frequency energy, that heat that then goes on to stimulate the collagen elastin. So you're creating a really nice healthy barrier, a lot more sort of the blood flow, so you're getting a better circulation. So you're getting that lubrication much, much better, so you don't get that vaginal dryness, and it makes a huge impact. So it just depends what's essential for that person. So that's why then sort of the doctors will guide you through as to what is actually more suitable, what your needs are, whether it's a combination. Sometimes it's a combination, you can alter it, or perhaps for some people it's just one of the hand pieces. So different options there.
Shirin, what's most popular for you? What do you tend to use the most of?
The VTone actually is really popular, and then the radio frequency Forma. Actually, I do quite a lot of Morpheus 8Vs as well, because I found that it has an impact in Lichen sclerosis as well.
Really? Okay, fantastic.
So it improves the quality of the tissue as well. And with my LS patients, I always offer them an internal treatment as well, because many of them are perimenopausal.
Yeah.
So they get the internal and the external treatment for that. Yeah. And it takes a little bit of time to see the results for treatments like these. So with Morpheus 8V, just like with Morpheus on the face, you may or may not see a result with the first treatment, but as you go through the course and as you allow time for the collagen stimulation, you often see a really good result.
Yeah, it's good. That's what we need more of, for sure. I said, does it hurt? Does it hurt? I mean, what does it feel like?
Externally, it's similar to having a facial treatment. So again, people have different pain thresholds. Internally, you barely feel it at all. With the numbing cream, you don't feel anything.
Okay.
And people are really surprised by that, because they're actually more afraid of having the internal treatment. but you don't have the same nerve receptors, the same pain receptors in the vagina that you have on your external skin. And there's a reason for that, because if you did, you'd never have intercourse and you'd never have children.
Well, let's talk about sex, okay? Because I think, again, that tends to be quite a taboo subject, especially with females. You know, we talk about incontinence, we talk about prolapses, atrophy, but, you know, we don't so much talk about sexual sensation, and that is really decreased in women, especially at a certain age when we hit menopause, after children, perimenopause, which can last for years. Does this improve your sex life?
Yes, 100%.
How does it improve your sex life?
So with the radiofrequency and the collagen stimulation, you get tightening.
Yeah.
Okay, so you then feel penetration more. The other thing is, like Claire was saying, you get an improved blood flow to the area, and that improves the sensation.
So we're going to get better orgasms?
Hopefully, yes.
I mean, this sounds great. What's not to love?
But also the men feel the difference as well, apparently.
Yeah, I have also been told this. You know, great nights. It does make a big difference. And I think that's also something really nice, because you just get used to what your body is used to. And when you do actually start to make changes, you do notice it, and so does your partner. And I think that's really good. You know, just because we hit a certain age doesn't mean we shouldn't be enjoying sex. We absolutely should. And we should be talking about it more as well.
Yeah. Well, I think you often find that women have their sexual peaks later in life, don't they?
Yeah.
So why should we stop enjoying sex when we're in the prime of our sexual lives?
Absolutely.
Absolutely. Okay. So 50% of women experience postmenopausal atrophy. What is
More
atrophy?
than that. It's actually 70%.
70%.
70% of women will have genitourinary syndrome of menopause, which is what it's called now, because that encompasses all of the symptoms that you get with the genitals, not just the dryness.
So what is it? Tell me what atrophy is.
So atrophy itself is thinning of the tissue due to loss of estrogen. Going alongside that, you get reduced blood flow, you get reduced lubrication, you get dryness, you can get painful intercourse, tearing on intercourse. Also, as the vagina loses tissue and it becomes more lax, you're more prone to prolapses and things like that. With the loss of estrogen, women are more prone to UTIs as well, because the bacteria in the vagina changes with the change in pH due to the loss of estrogen. So that's why women tend to get more UTIs with menopause as well.
So we can help all of those symptoms?
Yes.
So we shouldn't be living with them. We should be helping them, for sure. 100% of women experience abdominal muscle separation during pregnancy. Does it ever go back?
Not on its own. You can do all the planks you want, you can do all the sit-ups you want. I'm living proof of that. Everything was really muscly and lean, except for my belly after the children. So you do get separation of the abdominal muscles. You need to have something quite powerful to build that muscle up again.
Yeah.
And some women need surgery because they just can't do it non-surgically.
Yeah. So you were talking about engaging your muscles, and it's the same with your tummy as well. So many people can't actually engage that, especially after pregnancy. So the tone can really help with that, the tone pads, which is also very comfortable.
My favourite treatment.
Is it really? Why is it your favourite treatment?
Because I'm trying to tone up my belly and get beach ready. Not that there's anything wrong with anybody on the beach, but it just builds a little bit of confidence, doesn't it? And where I have had children and I'm trying to maintain my core strength, your abdominal muscles are also part of your core.
Yeah.
So alongside your pelvic floor, it's important to work your abdominal muscles as well.
Because it's all linked.
It's all linked, yes.
And I think people forget that as well. You know, it is all about this here as well. And it is hard to do. So, you know.
It's such a lazy treatment and I don't have to go to the gym. I can just lie there with the pads on.
Why wouldn't we? How often do you get to have it done though?
Not often enough.
I know.
No.
I always think, I must have it done. I must have it done. I must do it. And you kind of forget to do it, don't you? And find the time for yourself to do it.
We're encouraging women to prioritise themselves. We should do the same for ourselves.
It's a bit of self-care, isn't it?
Absolutely.
It's a bit of self-care. Okay. I want to talk about vulvas.
Okay.
You and me always end up talking about vulvas, normally after a glass of wine, but we're going to talk about them today. Tell me, what is a vulva?
Okay, so the vulva is the name for the female genitalia. Okay, so it includes the labia majora, which are the outer lips, the labia minora, which are the inner lips, the clitoris, the vagina, the urethra, and the perineum. So the collective name for all of that is the vulva.
Right.
The vagina is the birth canal.
That's really interesting because I suppose it's the most common word. We always think vagina, but actually we should be saying vulva.
Absolutely. And when people call it a designer vagina, they're actually talking about the vulva.
Yeah.
Isn't that amazing?
Yeah.
So we talk about women checking their breasts regularly. We had a conversation once and you told me I should be checking my vulva regularly.
At least once a month.
Once a month?
At least, because, and you need to start checking it before you have problems, because you need to know what your normal is. And if you don't know what your normal is, and how are you going to tell when it's going wrong?
Yeah.
Okay, so it's really important that as we encourage women to check their breasts, we also encourage them to inspect their vulvas with a mirror, learn what it looks like, learn what it feels like, so that when you do get changes, you can identify them and seek help early rather than sitting there not realising that there's something wrong.
What are we looking for?
Any sort of changes. So once you know what your normal is...
Yeah, like a baseline.
Yeah.
Okay.
So any change from that baseline, so any change in the appearance of the skin, are there any rashes, are there any ulcers, is the skin becoming more white, is your tissue disappearing?
Yeah.
Are your inner labia disappearing into your outer labia?
Is that with like lumps as well that maybe?
Yeah, any sort of lumps, cysts, anything like that. So you need to know what you've normally got before you can identify what's different.
What sort of age do you think we should be checking from?
Teens.
Teens?
Yeah.
We should be encouraging
Wow,
them.
that's amazing, isn't it? That's definitely not communicated.
No, because as women we're taught to be embarrassed about our genitals. We're supposed to be ashamed of having sex. It's never meant to be for the woman, is it?
Yeah.
So we need to change that conversation. We need to empower our young girls to take pride in themselves, to not be embarrassed, to be able to speak out for themselves.
Why do you think there's so much embarrassment around it? Is it just our culture?
It's been going on for millennia, hasn't it? It's always about women being the lesser gender, women's health issues not being so important. I mean, I can talk to you all about the history of menopause through the ages as well, and the way women have been treated, from being dismissed to being put into sanatoriums.
Well, hopefully we won't do that anymore, but you never know. Sometimes I feel like I'm going crazy, so...
It's a little bit of a taboo, isn't it? So it stems from our parents and our families, and I think through cultures it will gradually improve and improve. Even with my sort of teenage daughters now, I mean, there is an openness about them. They do talk about things. They talk about periods. There's a lot more relaxed talk, whereas I didn't talk about periods even with my mum until I had them, and then it was still like, it was sort of closed off in a little box. But there is already, I think there's already starting to be a change, but we've just got to empower them to say, right, okay, you're coming of age now. You've got to be looking at this, this and this, and talk about all the other things related to sex and safety, and just teach them this is normal and you've got to do it, because it's important. If you can prevent something, you prevent it.
Yeah.
Whereas I don't think we do enough here in the UK to look at prevention. It's all like, let's cure it when we find it. But if we can prepare everybody, we've got more chance of winning the race, I guess.
Yeah, I think that's the way medicine should go, but funding will prevent that in the UK for I don't know how long. But if we look at a more preventative way, then you're not reacting to the problems.
Yeah.
So you come in to see your GP with high blood pressure, you get put on a pill. What would have been better is actually, when you're younger, them saying to you, exercise, eat healthily, cut out salt, cut out sugar, prevent the changes that will cause high blood pressure.
Yeah. It's the prevention is better than cure, isn't it?
Absolutely.
Much easier. And in the long run, it will cost less money.
Yes.
It's just trying to change that mindset and flick it around, which I think is important.
I was going to say, we're seeing quite a big shift in aesthetic clinics in the way they're approaching ageing and things at the moment, and hopefully that will filter out.
In what way?
So in aesthetics now, there's more focus on regenerative treatments and prevention of ageing, rather than just putting a plaster over it.
Yeah.
So a lot of clinicians are now looking at longevity treatments as well. So it's not just about how you look on the outside, it's how you are on the inside, optimising your gut health, optimising your exercise, all this biohacking.
Yeah. Which is really important.
It's really important, and actually the more we embrace that, the more we'll move towards a preventative medicine way of thinking.
Yeah. So we talk about menopause a lot with these kind of things, but this isn't an old person problem, this is a young person problem as well, isn't it? And we were talking about teenagers checking their vulvas. Let's talk a little bit about that, because, you know, there's always been that taboo around periods as well, hasn't there?
Yeah. I mean, hopefully that's changing now, because a lot more of what I see, I've got 2 young daughters, and even with them growing up, I was more open with them about when I had my periods and things. I didn't hide it from them. They're not embarrassed about their dad knowing when they've got their periods as well. When I was at school, if I went to the toilet, I used to hide my tampon or my sanitary towel up my sleeve. And you're going to the toilet like this, aren't you? But they're a lot more open about taking it with them and not feeling the need to hiding.
I still, if I am somewhere, I still hide it. But that's just something that seems to be ingrained in me, and we shouldn't be doing that.
Why are we told that we need to be ashamed of periods? It's something that most women have. And you're going to have it for many, many years. It's a natural part of our lives. So why are we still thinking it's embarrassing, it's dirty, and all the other stigma that's associated with it?
We need to be changing that. You know, I think we mentioned the word empowerment. I'm a big empowerment for women advocate, and I think we should be, like you say, empowering our daughters and the younger generation as well. I think that's really key, isn't it?
Absolutely.
Sure.
And it depends on their character as well when they're younger. I mean, my younger daughter compared to my middle daughter, my middle one, she's a lot more confident, and she just literally bounce up and say, I need to go to the toilet, I've got my period. Whereas my younger one, she's completely embarrassed. Maybe there's a male teacher, and they have this awful thing at schools, unfortunately, where they don't allow them to go to the toilet. And I've had conversations with the nurses, and I said, regardless of my daughter, but any female, young female, they don't feel confident or comfortable to express that perhaps their period's starting, just allow them to go. But they no, they've got to learn how to sit in class and go to the toilet. And I said, well, things need to change. And I think, you know, I'm speaking for my daughter, but you've got to do it for every young girl that's in that school, because you shouldn't put them in a position or a predicament where they close up and then they have a disaster. It breaks down their confidence, and then they won't be confident to speak up or do anything in the future. So it needs to change in schools too. It needs to be a better approach.
It's that education from a younger age, and I'm starting to see the changes for sure, but I think you're right, we need to be empowering our daughters, don't we? Because then they'll do it to their daughters, and it will get better with each generation, for sure. Tell me a little bit about your patient success. So you've been using Empower. You're one of our amazing KOLs for this, our ambassadors for this, and a women's warrior for me, which I love. But tell me a little bit about maybe one of your key success stories that you've had.
I've had so many. I absolutely love the Empower platform because it's got so many treatment modalities on one platform, and it means that whatever my patient comes in with, I've got a tool to be able to treat them. I've had patients who've had radiofrequency vaginal tightening that maybe with the non-invasive one didn't get the full result. So then we've gone in and treated with Morpheus 8V, and that improves their results. I think VTone is a spectacular treatment. I've already said this before, but I found that, again, with the less invasive treatments, not everyone gets a great result. It might be due to positioning, it might be due to the fact that their BMI is too big to actually get an effective non-invasive treatment. And with the VTone, it's a more direct stimulation of the pelvic floor. And it just delivers.
That's what we need. You know, people want to see results, don't they? When they're taking the chance and coming in for one of these treatments, they're feeling brave. I'm going to address this. I'm going to address this issue. And they're recommended by a qualified practitioner the right treatment to have. You want to walk away with a result.
Absolutely. And it's important to remember that there is no treatment that will work in 100% of patients. But when you've got a treatment that consistently keeps delivering in the vast majority of your patients, then you feel more confident to recommend it.
So, Shirin, there's some other modalities on the market for this kind of women's intimate treatments, which is really important, and it's good for us to be able to see more and more of these treatments coming to market. You've said why you like ours so much, which is great. Some of those treatments I can't have. I've got the copper coil. does that mean that I can't have everything on Empower, or can I still have everything on Empower if I've got a copper coil?
So now the Empower treatment uses bipolar radio frequency, so the distance travelled by the current is more localised. So one of the big advantages of the Empower RF system over some of the others is that you can still have treatments with a copper coil in.
Okay, that's pretty good. That's good. I'm going to try it all. I'm working my way through them. And I want other women to be able to do that as well, because there's so much that you can do with this. And it does really change your quality of life. And I think that's really what this is all about.
And I think that's one thing I do get in clinic day in, day out. I find that the work I'm doing is life-changing, and I get that feedback. It keeps me motivated to keep going.
Yeah.
I mean, when you do an aesthetic treatment on somebody's face and you give them their confidence, that's fantastic, and you've got a happy patient. But when you actually change someone's quality of life to that degree, so when I'm treating incontinence, when I'm helping my LS patients, treating sexual dysfunction, menopausal atrophy, that really, really impacts someone's quality of life in a physical way, not just their confidence.
Yeah. And mentally, you know, we're talking about building confidence. This is what it does as well. But you know, it's not just that, it can really affect you mentally if you're having these issues. So it's really nice to be able to offer that kind of thing. Shirin, do you ever see any complications with these treatments?
Fortunately, they're very, very rare. So all the devices that I've used, I've seen complications, not necessarily from my clinic, but from other places. Now, I think if you're properly trained, okay, that's a really important thing. I think you have to be medically qualified to do these treatments. Okay, and I'll go beyond that, and I say you need to have gynecological experience if you're treating women. Okay, it doesn't necessarily mean you're a gynecologist, but you need to have had some formal gynecology training. Okay, and if you haven't, it doesn't mean you still can't deliver it. Just pair up with a gynecologist who can help you with the diagnosis, who can help you with red flags. In terms of complications from these treatments, the only one I've seen is someone with a bit of post-inflammatory pigmentation after a multisafety.
Okay.
And that's it. And the thing with PIH is it fades with time. So it's not something I'm particularly worried about.
I think safety is a really big thing with these kind of treatments. We want patients to feel confident, and we want the doctors using the equipment to feel confident as well. So do you think these treatments are safe?
Again, in the right hands. Okay. What I really get worried about is when I see non-medically qualified people offering vaginal tightening, vaginal rejuvenation, incontinence treatments. I mean, even going as far as weight loss injections and things with no medical qualification
Background or anything, isn't it?
And God knows where they're getting them from. Okay. So I'm a firm believer that if you go to someone who's properly qualified, okay, again, there are no absolutes in medicine, so somebody may get a complication, but at least if you're in qualified hands, they're more likely to look after you through it.
Yeah, absolutely. Now, Shirin, we've been working together for a little while. What is it that you love most about InMode?
I think I love your energy.
Oh, me, we'll talk about me. Except for me.
I love this. I love the fact, so when I was approached about Empower, it was about creating a seismic shift. Okay, I've been working in women's health for nearly a decade. So I've seen a lot. So I've been very picky and choosy about who I work with. The main things I need to see are safety. I don't want to do anything that's going to harm my patients. And I need to see efficacy. Okay, because these treatments, they have a cost attached to them for the patient. They're all available privately. They're not on the NHS. And I think if a patient is paying out for a treatment, I want to be able to deliver something effective. So those are two key factors I look for. I look at the company's ethos as well. Okay, I don't want to work with a company that's going to sell to beauty therapists. And that's really important to me, particularly with these treatments, because I want to maintain the safety of my patients and the public at large.
Yeah, for sure. You know, I've been with InMode for a while now. I'm very passionate about the women's health part of this, and I'm really passionate about working with the best in the business, and that is definitely you, Shirin. So we're delighted to have you on board with us. So these treatments, we're treating women's intimate health. they're not widely accessible. You mentioned these kind of treatments are really only available in private practices.
It's only a small number of private practices as well, Victoria, because if you look at mainstream private gynecology, many of them haven't even heard of these treatments.
Yeah, just such a shame as well, isn't it?
But I think there's a responsibility that lies with you guys as a company to educate the doctors, even if they're not offering the treatments, they need to know what's available. Because, I mean, particularly with the conditions I deal with, they don't know.
Yeah.
And the women get fobbed off because actually there's nothing available on the NHS for them, which is why they're told to put up and shut up, really.
Yeah, they just don't know where to go, do they?
Yeah.
Which is why I think if there's a magical ball, you could pop into every single medical practice and have a private room where there's a gynecologist that offers these treatments, because every single woman that will go in there, oh, is that a special thing? It would make them question it. Oh, could I make an appointment? Could I go and see them? And it would be flooded, with all these women, because I know so many from people that have been models, and you have discussions, and it's just a point of reference. But if it was in every single GP practice, an area where somebody had a private room where they offered it, they could feel comfortable. They'll just pop into the doctors. They don't have to say, but they're going into that area where they can be dealt with professionally and guided through.
I think the problem, though, because, I mean, we've always said these treatments should be available on the NHS. They should be accessible to everyone. And the problem is funding, lack of interest.
Yeah.
We always get thrown in our face, oh, there's no evidence that they work. But actually the evidence is coming. With every treatment, as long as it's shown to be safe, it's then introduced.
Yeah.
And then the evidence builds beyond that.
Yeah.
So it's not like taking a tablet. It's not going to change your metabolism and give you side effects to that degree. We've been using these technologies for years and years in other parts of the body. They've been shown to be safe, okay? Whether or not they're effective for the vulva and the vagina, that's what we need to show. And actually, the more we're doing, like we've done a clinical study together that hopefully we'll be publishing later in the year. But more things like that you can get doctors to do with their patients, even if it's just collecting feedback and collating it.
Yes.
That just builds the evidence base.
The evidence is really key when it comes to the NHS. I know we've just done that study together, which is great. We've got more studies coming, and that's what we really need to do to kind of change the narrative on this and make sure that more and more people are talking about it.
Yeah, and I think the NHS is catching on slowly. Because many of my patients who've had treatments will go back and tell their doctors about it. I tend to write to GPs as well, if I've got permission to do so, to say I've performed this treatment on your patient for this condition. And they learn more that way. They find out what's out there. Because as doctors, one of the big complaints I have about our health education is that we're not even taught about women's health. Unless you actually go and seek the knowledge. When I did my GP training, it wasn't compulsory to do a gynecology rotation.
Yeah, that would be the first point of call for a woman having any issues. We've got to change it.
Yeah.
I've really enjoyed this conversation we've had today, ladies, so thank you so much. I want to say a special thank you to Dr. Shirin Lakhani, who's one of our amazing KOLs and ambassadors for the Empower RF machine and for InMode UK and Ireland. And also thank you to our wonderful clinical trainer, Claire, for joining us today on the sofa. Thank you.